Historically, if you look back, there's been kind of a shift for a little while. People initially were using heroin, and then you saw a shift to prescription opioids go up, and now I think what we're seeing is a more leveling off again of heroin. So it's interesting how things change, and I think it's directly related to what's going on in the economy and how providers practice. So in the 1990s, you had these pharmaceutical companies telling you that the prescription opioids were beneficial and that there was no potential for addiction. So we know now that that's changed. So you have the pharmaceutical company telling you that they're safe, that there's no risk for addiction. So of course providers start prescribing more and more. Patients become more dependent on it. The dose has to increase because patients need more medication to do the same thing. In 2013 in the United States, there were 207 or so million prescriptions written for prescription opioid pain medications. You jump to New Mexico 2 years later in 2015, we have 1.5 million of those prescriptions that were written. So when you think about our piece compared to the United States, it certainly has opened up the eyes of the prescribers and of the Board of Pharmacy and the DEA. We did start out number 2. We're making some really good strides. We're down to number 8 now, which is still, it's a jump toward the better, but we're still way too high when you compare us to the national drug rates. I think, I really don't know why we ran into that issue here. A lot of what I think is that we're our border on the U.S.-Mexico border, and I think that may have some to do as far as opioid addiction. But with the prescribers' practices, I cannot tell you. I do not know how New Mexico got so far derailed. No, I don't think it should be illegal. I think opioids can be certainly very beneficial when used appropriately. I would hate to see us go to a non-prescription opioid country. I think a lot of people need opioids, and there is a place for them. Look at terminally ill patients. They need that pain relief. So to outlaw them or make it illegal, I think would be a real disservice to those people and to other people who have chronic pain or even pain at the moment. Think about going through a surgery and not having pain medication that is adequate to take away your pain.